Hello, everyone, and welcome to episode 15 of the Pet Behavior Chat. So we've got a very cool topic today, and it's a topic that I know many pet owners, as well as also vets and veterinary teams, will be interested in. I know this because I get so many questions about it, and that is how we can manage pets who show aggressive behaviors at the veterinary clinic. And it's a big topic. It's a complex topic, and I'm going to try and break it down for you a little bit. I'm going to, first of all, talk about the three kind of major contributing areas that, in my experience, causes animals to react aggressively or defensively. And then I'm going to give you 5 practical tips on how, on what you can do or how you can kind of counteract them becoming aggressive at the veterinary clinic. So here we go. The first thing I do want to talk about, though, before we go into those areas, is that aggressive behaviors at the veterinary clinic are, in the majority of cases, I would say in 99% of cases, based on fear, anxiety, and stress. And it's because the animals are reacting defensively. They are trying to save themselves. They're trying to protect themselves. They are trying not to get hurt. They're trying not to experience pain. They're trying to protect themselves from perhaps situations that they don't understand, such as being restrained. So I think it's really important that we understand this, because only when we understand this can we only actually take appropriate measures to relieve that fear, anxiety, and stress. If we start to label these animals as aggressive, dangerous, nasty, bad, mean, you wouldn't believe the number of labels that I've heard in different veterinary clinics that I've worked in throughout my 25-year career. It's really prohibitive to label them in this way, because it already then sets us up for dealing with them in a certain way. And it doesn't allow the benefit of the doubt, and it doesn't allow for an understanding of what the animals are actually experiencing and what their emotional state is. So I think that's a really important thing to just clarify before we move into what do we think actually causes them to be so defensive, especially at the veterinary clinic, and what can we do to help them in these situations. Okay, so let's get started with the first part. So my first point as to why animals react defensively and aggressively at the veterinary clinic is increasing stress levels from exposure to the environment. So if you imagine them coming into an environment that's probably unknown to them, that they potentially already have certain associations with or feelings about, and we then have an onslaught of triggers, different types of triggers from the environment, whether those are visual triggers, or perhaps olfactory triggers, or maybe auditory, so things they can hear, things they can smell, things they can see. So all of those things are going to contribute how our pets feel in that situation. And this can be exacerbated by a number of things. So long waiting times and inappropriate waiting areas, that can be a massive contributing factor. So think about a pet that's already stressed. They perhaps didn't enjoy the journey in the car. Think about a cat that's in a cat carrier. They may already not feel too happy about being in the cat carrier. And then they have to wait in this environment that they might already have certain feelings and associations about for extended periods of time. And you can imagine that the longer the time goes on, the more those stress levels are going to rise. So that's the first thing, is that waiting time. The second thing is also the environment in which they wait. And I'm thinking here specifically about multi-species waiting areas, right? So where dogs and cats and maybe, a bird or a reptile, they might all be waiting in the same space together. And that can be really triggering and threatening, especially for cats, but also for dogs that might be fearful of other dogs, and of course other species. Or imagine a rabbit or a guinea pig whose natural predators are dogs and cats, to be waiting in that same waiting space. So those are things that already are going to contribute to these rising levels of fear, anxiety, and stress. And we use a really amazing resource that's been developed by Fear Free, but there are also other resources, which are these ladders of stress. And you can sometimes see these animals rising up these ladders of stress from being perhaps quite okay and calm when they come in to getting more and more anxious and exhibiting more and more stress behaviors as they wait. So these are all things that we need to take into consideration. And I'm going to touch on when we come to the second part, which is what can we do, how we can kind of mitigate some of these circumstances. But so that's the first thing, is this increasing level of stress from the environment that they are put into and from exposure to that environment. The second point is what happens when they actually get into the consultation rooms, right? So that whole kind of handling, examination, which of course is necessary. That's why they're there. That's why they're at the veterinary clinic, because, they're unwell and we need to handle them and we need to do something to them. However, we've got to understand how that potentially makes them feel. And some other animals are going to be more okay than others. But if you think about the fact that when we are exposing them to this type of handling, we take away their choice and we take away their control in that situation in most instances, right? So oftentimes, imagine an animal's placed onto an examination table, might be being held by a technician or a nurse, and then be examined by the veterinarian. Already that placing them onto the table means they can't use their feet very well, and they can't try to exhibit a normal behavior that they might, use in that instance, which is to try and avoid the situation, to get away. I mean, we do see animals try and jump off the consultation room table. And this is for good reason, because they don't want to be up there. However, we ask them to remain on the table, we restrain them, we hold them. And again, I'm not saying that this is not for good reason. Obviously, we want to examine them. However, we do need to think about things like, would they be more comfortable on the floor where they can move a little bit, and that movement might help to alleviate some of that fear, anxiety, and stress, especially when we're not being hands-on with them, right? So I think animals are often placed on a table, and then, perhaps it takes some time for the vaccinations to be gotten ready, or for injections to be gotten ready, or for things to be prepared. And all the while, the animal is on this table that they don't feel comfortable on. So could we think about doing that differently? Could we think about, letting them engage with something or roam around the room until we need to actually put hands on them and, do the things that we need to do, which sometimes don't actually take that long when compared to the amount of time that they're restrained, perhaps on a table. So it's that taking away of choice, that taking away of ability to perform natural behaviors that they would normally perform to try and deal with the stress that they're experiencing in that moment. And I always use a bit of an analogy here, which I personally find like I can relate to personally quite well myself. So I don't think many people actually enjoy going to the dentist, right? I think the dentist comes with a lot of the same sort of experiences that I think our pets experience or feel when they're at the veterinary clinic. And certainly myself, I had lots and lots of dental procedures when I was young. So probably from age between 10 and 15, I had a lot of fillings and I had a lot of dental work done. And that all left me with a not particularly good association with the veterinary clinic. There were some painful moments. There were just some moments that were really quite uncomfortable. And all of those things have predisposed me to not really enjoy going to the dentist very much. However, we need to go to the dentist. We need to go for our routine preventative dental care. However, the one thing that I really appreciate when I go to the dentist, and I have a fantastic dentist here in Abu Dhabi now, but the one thing that I really, really appreciate is that when I'm on the chair, in the dentist chair, I can raise my hand or I can indicate and communicate that I'm not feeling comfortable about something. And the dentist always tells me, if there's anything you're not okay with, just raise your hand and we'll stop immediately. We'll reassess the situation. In the past, I've received some local anesthetic gel if a scaling procedure was a little bit uncomfortable for me. But I was able to communicate that. I was able to raise my hand and say, hey, I'm feeling a little bit uncomfortable. This is really, not feeling great. The scaling on the teeth, there might have been a sensitive area in one of my teeth. And that having that control and that ability to speak up and that ability to actually voice how I'm feeling in that moment takes away a lot of the stress and anxiety that I feel about going to the dentist. And obviously our animals can't speak to us, but they do communicate. They do have communication tools, and sometimes they get quite big in their communication, right? Hence the topic of this podcast. They can react aggressively or defensively. And why should we not respect that communication? Again, if we're talking about an emergency medical situation where something has to be done urgently to help this patient quickly, then yes, perhaps we're a little bit, less able to be like that or to behave in that way. But if it's a routine appointment, if it's a vaccination, if it's a health check, if it's a dental check, if it's a skin checkup, if it's any of those things that is not an emergency procedure, then we should absolutely be listening to this patient's communication signals. And they may well be communicating that they are in pain and that something is uncomfortable, or the way that they're being held or handled in that moment is not okay for them. And alone, I think being able to communicate that will help some of our pets and will reduce some of that fear, anxiety, and stress. So they don't have a choice in the way that we engage with them, or that they're able to engage with us. And a lot of times we don't also give them the choice to disengage. We don't give them the choice to be able to move away. And so that's something that we need to be able to get better with. So yeah, I think those, that whole thing about restraining, taking away agency, taking away choice, forcibly restraining. I mean, the amount of times that, I know in veterinary clinics, animals are forcibly restrained, held, pinned down, with gloves sometimes, all that sort of thing, I think is really going to contribute about how they feel in that situation. And it could be that because of that, their behavior escalates and their fear, anxiety, and stress escalates, and that they start to growl or snap or react defensively, or try to bite to stop that interaction from happening, because it's the only communication tool they've got left, because we've perhaps not listened to their previous communication tools. So that handling and restraint is a second big point. And then, of course, we have learning. What do our pets learn from previous veterinary visits? And remember that learning to do with fear and pain is really strong learning. The things that happen in the brain, the neural connections that are made in the brain due to fear learning are extremely strong, because they're evolutionary really, really important, and because they have a true biological need, and there's a true biological motivation for that. So that fear learning can be really strong. And we talk about one event learning. So one single bad experience or one single event of fear learning at the veterinary clinic can predispose that animal to feeling really fearful and reacting defensively much more quickly in the future. And we often see this, puppies will come in for their first few puppy visits, and those will potentially go really, really well. But it might be that at the time that they come in for their neutering, or that there's a visit that they come in where they're actually feeling sick and unwell, or they're in pain, all of a sudden that association and that learning happens, and that makes them, or that predisposes them for how they're going to feel about future veterinary visits. So we need to be mindful of that, and we need to really think about emotional state in that situation. And we really need to think about alleviating fear, anxiety, and stress and pain very, very quickly, so that we try to prevent that fear learning from happening. So I think all of those things together, and I'm sure there are more, but those are the three that sort of come to the top of my mind, right? So the environment that the animals are placed into, the handling and the restraint, the taking away their control, their agency, and not respecting their communication and not allowing them to engage and disengage in the way that they perhaps prefer to, as well as the learning that occurs. All of those things can predispose our pets to acting defensively and aggressively at future veterinary visits. So just gives us a little bit of thought about why these things are happening. So I want to move to what can we do? What can we actually do to help? And this is equally important for pet owners, pet caregivers, who actually are able to advocate for their pets in that moment. But it's also really, really important for the veterinary team. And when I talk about the veterinary team, I mean everybody from the reception team, through the nurses, through the vets themselves, through the people that are looking after the pets, during their hospital stay, that might be, kennel hands or animal handlers. So the whole veterinary team really is responsible for thinking about how we can improve the situation so that we don't get pets becoming fearful and perhaps reacting aggressively or defensively. And I'm going to chat through a couple of points here. And this is a huge topic, right? And we can break this down, and I can go into more detail in future episodes, podcast episodes, but it's a bit of an overview of how we should start to be thinking about veterinary visits. So the first one is, it really starts before the pet even arrives at the vet clinic. So it starts with preparation, and that comes down to things like scheduling, planning the consultations, making sure that the front of house team, the reception team, are booking in and scheduling appointments so that we don't get this overloading in the waiting area, or that animals can potentially be put into their consultation rooms already whilst they wait for the vet to arrive. Or we could ask people, or you could ask the vet clinic, can you wait in your car if your pet feels more comfortable in the car until the vet's ready for your appointment, and then you can get out of the car and walk straight into the consult room. So these things are important to think about. Perhaps ask if the clinic has separated waiting areas. So we are an ISFM gold standard cat-friendly clinic, and as part of that, we have designated and separated waiting areas for cats only, so that we don't get that kind of multi-species waiting area situation, so that cats wait in separated areas. And you could ask if they have the same for small mammals, so your rabbits, your guinea pigs, or maybe reptiles, birds that you might be taking to the veterinary clinic. So, asking ahead of time, do you have a separated waiting area? Perhaps if the clinic doesn't, then you might be better off waiting in the car. So all of these things are really, really important. And the reception team can also be really instrumental in giving some advice and some tips on how you can best prepare to bring your pet to the veterinary clinic. So that might be the use of pheromone supplements or pre-visit pharmaceuticals, which I'll touch on in a second. Or it could even be giving tips on how to best familiarize your cat to getting into the cat carrier, to being comfortable in the cat carrier, and that not already being a massively stressful event for them. So all of these things are really important. And sometimes, I feel that by the time, if the pet reacts with fear, anxiety, stress, and maybe aggressive behaviors, once they're already in the consultation room, it might be too late. We might be too late for having some positive interventions. And again, if it's an emergency, then we have to deal with that in the moment. And there are certain strategies that we can employ to do that. But if it's a routine appointment and if it's not an emergency, then we really need to start thinking a few steps ahead. Because as I say, often by the time they come to the consultation room and they're already so worked up that they're reacting defensively, then it's probably too late and we need to rethink our strategy. So that's the first piece. The second piece is, if we have access to a really great trainer, we can start to think about teaching our pets a little bit about cooperative care. So cooperative care means that the pet is actually given the opportunity to consent to whatever is being done to them. So that could be that we teach them a chin rest and they consent to keeping their head still for a certain period of time so that we can examine their eyes and their teeth and have a look in their ears. Or we can we can teach them to perhaps do a paw target so that they target their paw to a certain area, and we either can look at that paw or we can then move that on to actually handling them for blood draws from a front leg, for example. So we can teach them so many things. And this concept originally comes from zoo animals, where we have to get some kind of cooperation a lot of the time if we don't want to chemically restrain them. So if we don't want to actually sedate them, which can be quite challenging for a number of zoo animals. we want them to be able to buy into their care. So that's teaching them certain things, maybe to open their mouth so that we can have a look at their teeth, or to present a limb so that we can do a blood draw. And we want to think about that similarly in our pet animals as well. So there are so many things that we can teach them. And again, this is a huge topic, and probably Ilse and I will do an episode just on cooperative care. But it's something that pet caregivers, pet parents, pet owners can get really involved in, and are going to be so useful when it comes to a veterinary visit. It's going to make the vet's life so much easier if he has an animal that knows a chin rest, so that they can examine their heads and their faces. But it also gives the animal an opportunity to say, hang on, I need to take a break quickly. And this is part of that consent, part of that cooperative care. So we teach them to do the maneuver, but we also teach them that they can say, right, that's enough. I need a quick break, and then come back and do the chin rest again, or present the leg again. So we always give them that option to disengage when they need a break, when they've had enough, when they can't hold still any longer. And that's the bringing back that choice and that agency that I mentioned earlier. So cooperative care is a really big piece, I think, going forwards. Number 3 is muzzle training. Now, if you know that your pet is likely to react defensively, if that's something that they've done in the future, then you might know that the vet, once your pet gets to the clinic, I'm talking about dogs here, that your dog will perhaps need to be muzzled, that the vet is going to ask for your pet to be muzzled in order to safely be able to examine them. And if putting the muzzle on your pet in that moment, and your pet is not used to wearing a muzzle, or finds wearing a muzzle really distressing, it's just going to add to the distress that they feel during that vet visit. And remember what we talked about learning. It's going to make them learn that going to the veterinary clinic just means all the bad things. It means I'm restrained, I've got no choice. It's probably something painful is going to happen. I'm going to have a muzzle shoved on me. I don't feel comfortable with any of those things. So the next time I go to the veterinary clinic, I am going to already react defensively before anybody can even get near me to do those things. So having a dog that's really well muzzle trained, that enjoys wearing the muzzle, that enjoys putting the muzzle on themselves almost, it just removes that particular element of stress, and it's a safety measure. So we talked in episode 13 all about safety measures, and that's something that we absolutely need to be thinking about when we have a dog that might present aggressively in the veterinary setting. But training them to wear a muzzle happily, confidently, comfortably is going to be a massive piece here. And in the show notes, I am actually going to give you access to our free video, which is a free muzzle fitting video, because before we can train our dogs to wear a muzzle, we need to make sure that we get a muzzle that's appropriate and that fits really, really well. So you're going to get access to our free muzzle fitting video. And then if you would like, you can go on to our actual muzzle training course, which is a 3-part course that Ilse does. That's absolutely amazing, and will set you up for success if you would like to train your dog to wear a muzzle. So that is the third thing. So number 1 was preempting things, so starting to plan, when you go to the veterinary clinic, all about visits and waiting areas and that sort of thing. The second thing was cooperative care. Third thing is muzzles. And then the fourth thing I would like to talk about is pheromone supplements and pre-visit pharmaceuticals. So I'm not going to go into too much detail around the types of medications that we might use. I'm going to save that for a separate episode. But just to let you know that there are things out there that can help prepare your pet for a veterinary visit. Now, we can use things like pheromone products. I'm talking here about Feliway and Adaptil. Feliway is the product for cats. Adaptil is the product for dogs. You can pre-spray your cat's carrier with Feliway, for example, or you can offer your dog, before you leave to go to the vet clinic, a food puzzle maze that's been pre-sprayed with Adaptil, or you can spray some Adaptil on a little bandana and pop that around your dog's neck. And that will help to relieve some fear, anxiety, and stress during the car ride and when they get to the veterinary clinic. At my clinic, we always offer We have blankets that have been pre-sprayed with Feliway that we will pop over the cat carriers. Number one, to protect the cats from some of these kind of visual and noise triggers, but also to have a calming effect via the pheromone on them. So pheromones are great things that you can use in the preparation to going to the vet clinic. We have some natural supplements. The ones I particularly like are Zilkine and Angzitane. They can also be given as a one-off and be given to your pet before you go to the veterinary clinic. And then we have our pre-visit pharmaceuticals. So I'm talking here about medications, psychopharmaceuticals that are very quick in onset. So they take anywhere between 30 minutes and about 90 minutes, depending on the medication, and have a short duration of effect. So anywhere between 4 hours and maybe 8 hours. So there's something that can be given to your pet. It's going to work pretty quickly, but then the effects are also going to go away pretty quickly. So it's really intended to just help them through that event, that veterinary visit. And we call these event medications. Examples of these are gabapentin. Gabapentin has been an absolute game changer for cats in practice as a pre-visit pharmaceutical, or pregabalin, which is a similar medication to gabapentin. We can also use things like trazodone. We can use the product Cilio, or we can use clonidine. So there are a number of different medications, depending on your pet, that can be used alone or in combination to really help them feel less fearful, anxious, and stressed in the veterinary clinic. Now, they're not sedatives, although some of them might have a slightly sedating effect, but they're not sedatives. They are called anxiolytics or anti-anxiety medications. And imagine yourself, if you had a phobia of flying in airplanes, for example, or if you were fearful also maybe of going to the doctors, if you had a procedure booked in and that made you really, really fearful, the same is available for people. So you could take a pre-visit anti-anxiety medication. So examples of this could be Valium and Xanax for people, which we can also use for animals as well. But they're the kind of medications to help you through a difficult event. Now, these are veterinary prescription medications. You do need to work with your veterinarian if you want to use a pre-visit pharmaceutical. And you want to perhaps ask your veterinarian if that's an option and if they can prescribe something for your pet before you bring them to the veterinary clinic. And like I say, it's been an absolute game changer for us, especially for some of the more fractious cats or the anxious cats that we see. Gabapentin has been a really big game changer. And pet caregivers are so grateful when they perhaps bring their pet in and the pet is hugely stressed, acting defensively, trying to get away, avoiding, maybe showing some signs of aggression. And we say to them, okay, let's abort for now. We're going to send you away. Please give your pet these medications before you bring them back to us. And then they bring them back, might be the next day, might even be the same day in the afternoon. And they see the change in their pets, how much calmer they are, how much more better they are able to tolerate being handled and having these procedures done. So again, it's a really great option for, routine procedures, non-urgent procedures. I just want to really clarify that obviously if we're talking about an urgent or emergency medical case, then in those moments we just have to, do what is necessary to help the pet in that moment. But there are other things that we can do. Again, a topic for another podcast, but things, even in an emergency setting, there are many things that we can do to help pets with a better experience at the veterinary clinic. So that was my fourth point. And then my final point is finding a vet. So for pet caregivers or pet parents, pet owners, finding a vet who is really actually sensitive to the mental and emotional needs of your pet as well as their physical needs. So finding perhaps a fear-free certified clinic if you're in the US or Canada, or maybe vets who themselves personally have gone through fear-free certification. So In my clinic, for example, every single member of my team, whether that is a receptionist or office admin staff or the vets, everybody goes through fear-free certification, personal fear-free certification, and we are just about to also become practice certified. So to become a fear-free certified practice, which up until recently was only possible for practices in the US and Canada. Fear-free are now rolling this out to the UK, Australia, New Zealand, and here in the UAE, we are going to be the first fear-free certified practice in the UAE. We're also a gold-friendly, cat-friendly clinic. So if you have a cat, maybe look for cat-only practices or practices that are certified by the ISFM as being a cat-friendly clinic, and you can either be bronze, silver, or gold status. So looking out for practices that have really bought into this new way of practicing, which is really important for the welfare and well-being of our patients, but also our clients. So looking for those practices and, asking some questions beforehand as to what they can do to help alleviate your pet stress. So that's really important. And for vets and vet teams, have a think about becoming fear-free certified, have a look into that whole process. And perhaps understand that there are different ways of doing things. There's lots and lots of CPD out there. There are a lot of webinars. I've done quite a few webinars for different groups. Again, you'll find a lot of information on the Fear-Free website if you are thinking about looking into this further and learning how to practice in this way a little bit more. So really looking out for those practices that are kind of invested in this way of practicing. And also really thinking about, what are our pets communicating to us? How are they able to communicate? What are their body language signs? Again, lots of resources on understanding through their body language whether they're experiencing fear, anxiety, and stress, and then changing things up to help them in these situations. So those are my 5 things. And I really want to kind of leave on this note. I just want to refer back to something that I spoke about with Andy Hale. I think it was in episode 10, which was our Boxing Day episode. It came out on the 26th of December, 2023. And Andy and I spoke a lot about this task versus care dichotomy, if you like. And that is something that as vets we do need to be mindful of, is that sometimes we get so locked into performing tasks, whether that's getting a vaccine done or getting a nail trim done or expressing anal glands or whatever it might be, that sometimes we forget that care element. And that can be really challenging for our patients. So that's something that I just really want us to consider as a profession, as pet caregivers, pet owners, is that task versus care. And if you'd like to find out more about that, have a listen to episode 10 of the Pet Behavior Chat and hopefully get a little bit more insight on that. So I hope you found this episode useful and valuable. Just a few things to think about in terms of veterinary visits. And we're going to be delving much deeper into this topic in upcoming episodes of the podcast. And again, remember, if you think that your pet, your dog is likely to react defensively or aggressively, check out our free muzzle fitting video and maybe think about our muzzle training course where you can learn how to teach your dog to wear their muzzle happily, with confidence, comfortably. And that's going to be such a great, great tool for you, not only at the veterinary clinic, but in so many different settings. All right, I am going to leave things here. I hope you've enjoyed this episode, and I look forward to seeing everybody in episode 16. All right, bye for now, everyone.